Sweden's strategy to contain the spread of COVID-19 has garnered international attention as Europe's outlier. Unlike in the rest of the continent, schools, gyms, cafes, bars and shops have, in many cases, stayed open throughout the spread of the pandemic. Sweden's death rate is higher than elsewhere in Scandinavia at nearly 22 per 100,000 inhabitants. But it is well below the levels in other European nations such as Spain, Italy and the UK, both in absolute and in relative terms. Let's talk now to Lena Hallengren, who is Sweden's Minister for Health and Social Affairs. Really good to speak to you, Minister, this morning. So why do you think that the Swedish death toll, as measured per head of population, is worse than your other Scandinavian neighbours?
Good morning. I think it's a bit too early, really, to compare Sweden and the Swedish strategy and the death toll with any specific country, because we're in different phases and we're just, unfortunately, I think we're in the beginning of this pandemic, so it's too early also to draw any firm conclusions what has been working and what hasn't.
But Sweden did wait a while before it seemingly realized the lockdown that was necessary. So do you think you're going to feel the brunt of that throughout the heart of this pandemic?
I'm not really sure in what way we waited. The 1st of February, we classified the coronavirus as a disease danger to the society, and that gave the possibility to have also very drastic measures for the chief doctors. But after that, we have been banning visits to elder care homes, public gatherings, about 50 persons. We have also decided that all the upper secondary school students, as well as the one in higher education, have to be studying online. 30% of the labor force are working at a distance from their own homes. All the people above 70 are in, I wouldn't say isolation, but I think that's how they feel when they are very restricted with their social contacts. So lots of things have happened, as well as the.
So hang on, are you saying you didn't wait then, Ms. Minister? Are you saying you didn't wait then to close restaurants and cafes? You didn't wait to close salons? You didn't wait to force social isolation on people, as was happening in Spain and Italy and Germany?
No, that's not what I said, because we haven't closed our.
You said you're not sure how you waited, but it seems like everyone watched you wait. No, everyone. I don't know what they're waiting for, but I said that we didn't. I thought you said that we didn't realize the seriousness of this virus. I will say that we realized that this is very serious. That's why we classified it 3 months ago as a disease danger to the society. Afterwards, we've been taking lots of different decisions. One of them is not to close down all the restaurants, cafes, and shops. But people are very restricted in what they're allowed to do and what they are doing. And the outcome of that is that lots of our businesses, our shops, our cafes and bars, they are closing down because they don't have any customers. So we haven't got a total lockdown in the whole society, but I don't think that is the same thing as to say that we didn't realize how serious this is.
Is there still room to toughen up the lockdown, Minister? Will you consider bringing in tougher rules if you see that the toll on your population is greater than neighbouring countries?
We're always considering what is the right measure and what is the right time to decide about them. So we have been making lots of decisions the last month, but we're not looking at our neighboring countries trying to fine-tune our own measures. We're looking at the national circumstances. We're looking at how the virus is being spread, where in Sweden it's spread, among which population, what part of the country, what could be done to have the best result, and that is not mostly due to the situation in other countries, but in our own country.